Okay, now let's get started. So, in the last session, we have completed our chapter number second. So, let's do the quick recap for the chapter number second. In the chapter number second, we just have a few guidelines that we have to keep our reason of encounter as a primary diagnosis. So, whatever the reason of the encounter is, we have to keep that at the primary position, and the other condition will be our secondary diagnosis. The exception in that guideline is if the patient have the anemia due to the neoplasm. In that case, we have to code anemia as in primary and neoplasm as in primary and anemia as in secondary, even though patient is coming to get a treatment of the anemia. So for all other cases, we have to use reason of the encounter as a primary diagnosis, and we have to keep in mind that whatever the treatment is providing, we have to use the related diagnosis as a primary diagnosis. But if the patient have the anemia due to neoplasm and patient is getting the treatment for the anemia itself, in that case, we have to use neoplasm code as a primary, anemia as a secondary, even though patient is getting a treatment on the anemia. Let's move further. And chapter number 3 does not have any specific guideline. Chapter 3 codes begins from D50 to D89, and we have to use code series D50 to D89 whenever patient have any blood and blood forming organ disease. If patient have the blood cancers and the lymphoma cancers, in those cases you have to use a code from series C00 to D49. But if the patient have the disease due of the blood and blood forming organ, in that case you have to use D50 to D89 codes. In this chapter, we does not have any guidelines. Maybe in future we will get few, but right now it does not have any guideline for this chapter. Next chapter we have chapter number 4, endocrine, nutritional, and the metabolic diseases. So any condition of glands, any nutritional conditions such as malnutrition, overweight, underweight, and the metabolic diseases, vitamin deficiency, bone deficiency. In that case, we have to use a code from series E00 to E18. In this chapter, we do have a code for the multiple sections such as endocrine organ disorders, nutritional disorders, as well as the metabolic diseases. But we have the guidelines only for the diabetes. In this chapter, we will get the diabetes guidelines only. So we will get the guidelines for the diabetes only. Just give me a second. Okay, let's start from the guidelines now. So for diabetes, we have two type of diabetes: primary diabetes and secondary diabetes. Primary diabetes means that patient have a diabetes, normal diabetes like hereditary diabetes or the juvenile diabetes. These are the diabetes where the patient is not able to produce the insulin. That is the diabetes, primary diabetes. So primary diabetes is further divided into the two parts: type 1 and type 2 diabetes. Type 1 diabetes and type 2 diabetes. Type 1 diabetes is also known as insulin dependent diabetes. So, type 1 diabetes is also known as insulin dependent diabetes. But because in the type 1 diabetes, patient is not able to produce the insulin at all. So, in this case, we have to use type 1 diabetes. Type 1 diabetes code starts from E10. Type 1 diabetes is also known as juvenile diabetes. So type 1 is a type of diabetes when the patient starts getting the disorders before reaching to the puberty age or before reaching to the adolescence age. So that is a type 1. So if the patient have a type 1 diabetes, we have to use a code from series E10. Next we have type 2. Type 2 means hereditary diabetes. Hereditary diabetes. That means if our parents have the diabetes, maybe in future, if due to our lifestyles, we might get diabetes also. So type 2 code starts from E11 series. And when the type of diabetes is not documented, in that case also you have to consider it as a type 2. So by default, if the type of diabetes is not documented, by default you have to consider this as a type 2 diabetes. So whenever the type of diabetes is not mentioned, you will bill type 2 diabetes. Type 2 diabetes code starts from E11 series. And if the patient have the primary diabetes and patient is using the insulin, oral hypoglycemic drugs, oral hypoglycemic drugs are anti-diabetic injections. In that case, you have to use a long-term use of insulin or drug codes as a secondary diagnosis. So let me show you here. We do have a code from series Z79 and you have to use that series whenever patient is using a medicine or any drug from the long term, JKL. To 90. Here we go. Long term. So whenever patient is using any drug therapy from the long term, we have to use a code long term use of series. So let's say if the patient is managing the diabetes and from the anti-diabetic drug injectable, which is non-insulin, then in case you have to use the Z79.85 after the diabetes. And if the patient is using the oral anti-diabetic drug, in that case, you have to use Z79.84. If the patient is using the insulin, in that case, you have to use Z79.4 in conjunction with your primary diabetes codes. So whenever patient have the diabetes, first you have to code the diabetes from series E10 or E11 based on the type of diabetes. And then you have to use a code from series Z79 to represent the drug therapy if the patient is using from the several years or from the several months. If the patient is using a drug for a temporary basis, if the patient is using a drug on the temporary basis, in that case, they to code long-term wala code. If the patient is using a drug on a temporary, So in that case, you will not use a code from series Z79. Why? Because that Z79 series needs to be used only if patient is using a drug from the long term. If the patient is using a drug from the long term, then only you have to use a code from series Z79. If the patient is using a drug for the temporary basis, in that case, you will not use a code from series Z79. I have to show one more thing. For the diabetes, we have a combination codes. Combination codes means you can see here under the diabetes, we have so many conditions. Let's say patient has the diabetes as well as amyotrophy. So in that case, we have to use a combination code that is E11.44, which will represent diabetes as well as amyotrophy. So whenever patient have the diabetes as well as any other condition, and you have the opportunity to find a code, a combination code which will represent both the condition, in that case, you have to refer the combination code or you have to use the combination code only. If patient have a multiple complications, such as let's say patient have the diabetes, amyotrophy, cataract, and CKD. In this case, you have to use three codes. So you will use E11.44, you will use E11.36, you will use E11.22. You will code all the complication listed in the question. So if the patient have the multiple complication, you will code all the complication listed in the question. So you can see here, if the type of diabetes is not mentioned, your code is taken from series E11. All codes listed are E11 from series E11. And if the type patient have the type 1 diabetes, our codes begins from E10. And if the patient have the type 2 diabetes, in that case also we have to use a code from series E11. Any questions so far? Okay. I'm going to send one question. Just attempt that question. Then we will move forward. I have shared two questions. Just attempt the first question only. We will do second question later. We just received the answer from 2. So let's see what will be the correct answer. The patient have the diabetes with the hyperglycemia as well as the diabetic nephropathy. And in our documentation, type of diabetes is not documented. So whenever the type of diabetes is not documented, we have to use a code from series E11. So patient have the diabetes with hyperglycemia, so our code should be E11.65. Next, patient 2 have the nephropathy, so we have to code the nephropathy too. So for the nephropathy, our code should be 21 instead of the 40. Just look at my screen. For the nephropathy, code should be E11.21 instead of the 40 or 50. Clear? Jamil, how you have find the E11.50? Jamil, how you reach to the E11.50 code? Okay. So we have to use two codes here. We have to use E11.65. We have to use E11.21. And the patient is using our insulin from the long term. So we will use Z79.42. Any questions so far? Okay. Now let's get back to the guidelines. So these are a guideline. So first one is we have for the diabetes mellitus, we have the combination codes that will describe the type of diabetes as well as the any further complications or the manifestation if there is any with the diabetes. So if based on the type of diabetes, first we have type 1 diabetes, then we have the type 2 diabetes under the primary diabetes. We do have one specific code for the pre-symptomatic type 1 diabetes. The patient do have the type 1 diabetes, but the patient does not start getting the symptoms as of now. Patient have diabetes, but patient is not getting any symptoms as of now. So in that case, you have to use E10.A series. And if the patient has type 1 diabetes, in that case, you have to use E10 series. If the type of diabetes is not documented, by default, you will consider it as an E11. And if the with diabetes patient is using the insulin, any oral hypoglycemic drugs, or any injectable non-insulin drugs, in that case, you have to use Z79 codes, whether 84, 85, or 84, based on the type of drug in conjunction with the diabetes. Remember, you should not use Z79.4 if the drug is given based on the temporary basis. So if the patient is using a drug from the long term, in that case, you are okay to use the Z79. But if the patient is getting a treatment for a temporary basis and else the diabetes is managed on the lifestyle, in that case, you don't need to use any Z79 code because patient is not using a drug from the long term. Next up, next we have the secondary diabetes. I'm skipping the complication for now. Let's start with the secondary diabetes. So, secondary diabetes. Secondary diabetes means patients have the diabetes due to any other condition. Whenever patient have the diabetes due to any other reason, in that case, you have to use a code for the secondary diabetes. We have three type of secondary diabetes. First is diabetes due to disease. Patient have the diabetes due to disease. Next we have diabetes due to drugs. And in the last we have post-procedural diabetes. Post-procedural post-procedural diabetes. So whenever patient have a diabetes due to disease, in that case you have to code disease as a primary diagnosis, and diabetes diabetes as a secondary diagnosis. And for the diabetes, you will use a code from series E08. So I'm filling up the code one more time here. So whenever patient have the diabetes due to disease, due to underlying condition, your diabetes code should be from series E08. So whenever patient have the diabetes and diabetes is due to the disease, in that case you have to keep your disease at the primary position followed by the diabetes code, and your diabetes code should be from series E08. To locate the code, what you will do? You will refer the diabetes in the index. Under diabetes, you will look for the due to underlying condition, and under the underlying condition, you will look for the code. And if there is any complication, you will look for the combination code. Next, we have diabetes due to drugs. If whenever patient have a diabetes due to drug, our code series are divided based on the two type of effects. If the patient have a diabetes due to poisoning, in that case, you have to code poisoning at the primary position. As in coder, we are not allowed to use poisoning at the second position ever. Whenever patient have the poisoning, not for just this chapter, even in the future or even in the other chapters, if the patient had the poisoning, your poisoning code will be the primary diagnosis in all the situations. Whenever the patient have the diabetes poisoning, you have to make sure you need to keep poisoning code at the primary position. So if the diabetes is due to the poisoning from the drug, you have to keep the poisoning at the primary position followed by the diabetes. And your diabetes code is from E09. How to locate the code? You refer the diabetes in the index, and under the diabetes, you will look for the due to drug or chemical. You can see here. So we have the option due to drug and chemical, and our all codes are listed from series E09. So if the patient have diabetes due to the poisoning, you have to keep your poisoning diagnosis at the primary position followed by the diabetes code. And your diabetes code should start from E09. And the second situation is when the patient have the diabetes due to the adverse effect of the drug. So whenever patient have any condition due to the adverse effect of the drug, in that case, you have to code the effect. That means diabetes at the primary position. Your diabetes code will be your primary, and you have to keep adverse effect at the secondary position. So whenever patient have any condition due to the adverse effect, in that case, you have to code adverse effect at the second position and the diabetes at the first position. You have to use E09 followed by the adverse effect. So first you have to code the diabetes, then only you are allowed to use the code for adverse effect. Remember one thing, you have to keep poisoning at the primary position always, and you have to keep adverse effect at the secondary position always. You cannot use poisoning at the second position ever, and you cannot use adverse effect code at the primary position ever. And the third situation we have here, diabetes due to the procedure. Post procedural means procedure performed on the pancreas. Let's say patient had the pancreatectomy, patient pancreas has been removed. So in this case, whenever patient have any post procedural diabetes, in this case you have to use E89.1 as the primary position, followed by the E13. E13 is for the diabetes. And then we have to quote absence of pancreas to represent that pancreas has been removed from the patient's body. So first, we have to use post-procedural hypoinsulinemia. E89.1 is for post-procedural hypoinsulinemia. Then we have to code E13. Why we have to use a code from series E13? Because if you look for the diabetes and under diabetes, you will look for the post-pancreatectomy or even the post-procedural. Our book will lead us that you have to look for diabetes followed by the specified type NEC. And in the specified type NEC are all codes listed from E13 series. So whenever patient have a diabetes due to the procedures, in that case you have to use a code from series E13. So you have to keep hypoinsulinemia. E89.1 is for the hypoinsulinemia, which will represent that patient have the low insulin in the blood, followed by you have to code diabetes, and in the last you will use the code for the absence. And for the absence, you will refer absence in the index. Here we go. Absence in the index. And under the absence, you have to look for the pancreas. As the pancreas has been removed surgically, you have to pick acquired here. And under the acquired, you have to use any code from these below three conditions. So if it is in partial, you have to use 411. If it is complete, 410, total 410. So you have to keep absence code from series Z90.41 at the third position. Also, even for the secondary diabetes, patient is using any drug for the long term. In that case, you have to use Z79 code at the last to represent that patient is using any particular drug to manage the diabetes from the long term. Any questions so far? Any questions? I have a message. Sorry, then it's 40. Okay. Okay. Kashish, I don't know why you guys are unable to unmute yourself, but no problem. So Kashish, I can see your message that you are unable to find the code in the PDF. So let's say we have to find a code for the diabetes. What you have to do, you have to look for the diabetes in the manual, and you have to look it in the way we will use in the dictionary, that every condition is listed alphabetically. So at the top of the page, you can see from which condition to which conditions we have the code here. And once you reach to your condition, then you have to look for the condition or the classification. NEC stands for not elsewhere classifiable. So you can see here. So whenever patient have the post-procedural diabetes, we does not have any specific diagnosis here for that. So in that case, book is referring us to use a code from series NEC. So NEC means not elsewhere classifiable. Clear? Perfect. Okay. You want to do any question from the secondary diabetes, or we are good to move further? Okay, let me do one thing. Let's go through with the guideline once. If we are able to follow, then we will not do the questions. If we have any doubt, then we will try to solve the question. So here we have the guidelines. Secondary diabetes mellitus. So secondary means whenever patient have a condition or due to any other reasons. So patient have the diabetes due to any other reason. So we have three type of secondary codes: E08, E09, and E13. You have to use E08 whenever patient have a diabetes due to disease, E09 whenever patient have a drug-induced diabetes, and E13 any other specified reason, maybe due to the post-procedural, any other reason. Secondary diabetes, even for the secondary diabetes, we have to use a Z79 code to represent that patient is using any particular drug from the long term. Then we have E13 whenever patient have a diabetes due to the pancreatectomy. In that case, what you will do? You will use E89.1 at the primary position, followed by 13, E13, and then you will use Z90.41 to represent that patient pancreas. Patient does not have the pancreas. Next, we have secondary diabetes due to drugs. If the patient have a diabetes due to drug, in that case, if it is due to poisoning, you have to keep poisoning at the primary position. If it is due to the adverse effect, you have to keep adverse effect at the secondary position and diabetes at the primary position. Any questions, any doubt?
No.
Yes. Okay. No.
I didn't got Z90.41.
Z90.41. To find the code for the absence, you have to refer abscess in the index. I'm going to fill that up for you. So you have to refer absence in the index. Under the absence, you have to find out that organ which is missing. So in our case, we are looking for the pancreas. So here we have the pancreas. Here we have a two options, one for the congenital and the another one in for the acquired. Congenital means that patient does not have the pancreas since birth, that means congenital, and acquired means surgically removed. Surgically removed. So in our case, it has been surgically removed. That's the only reason patient is coming with the post-procedural diabetes. So we will use a code from series acquired. And under acquired, we have a two option, complete and partial. If the complete pancreas has been removed, in that case, you have to use Z90.410. If the partial pancreas has been removed, you have to use 411. Clear? Is it clear how to find the code Z79? Sorry, Z90. Okay, I'm moving further. So let's move to the another topic now. Next is complications. Complication due to the insulin pump malfunction. So first we have to understand when we have to code the complication. Whenever patient have any condition due to the implant, due to the procedures, or due to the devices, any condition occurs after the surgery, in that case, we have to code the complication. And we have to make sure that we have to keep our complication code at the primary position. We cannot code complication at the secondary position. So let's back to the guideline now. So whenever patient have the insulin pump and it started malfunctioning, malfunctioning means that the insulin pump is not functioning properly. In that case, what you have to see, you have to see whether due to the complication patient is getting the underdosing of the insulin or the overdosing of the insulin. If underdosing or overdosing. Because if the patient insulin pump is not functioning, that means patient is not getting the sufficient insulin or getting the extra insulin. So first you have to look whether if the insulin pump starts malfunctioning, you have to look whether it's an underdosing or the overdosing. If it is an underdosing, in that case, you have to code complication at the first position, underdosing at the second position, underdosing at the second position, and diabetes at the third position. Diabetes at the third position. And if the patient is getting overdosing of the insulin, in that case also you have to code complication as a primary diagnosis. To find a code for a complication, you have to refer complication in the index. Under the complication, you will look for the insulin pump and then mechanical breakdown. For underdosing and overdosing of insulin, what you have to refer? You have to refer table of drug and chemical. So we have a table of drug and chemical here. So if due to the insulin pump failure or insulin pump malfunction, patient is getting the high dose of the insulin or the less dose of the insulin, in that case, what you have to do, you have to code the complication first. Then From the table of drug and chemical, you have to look for the insulin and you have to pick whether it's an overdosing or whether it is an underdosing. For overdosing, you have to refer poisoning accidental. So for overdosing, you have to refer poisoning accidental. And for underdosing, you have to refer here underdosing itself. So first you have to use a code for complication, followed by a code for insulin underdosing or insulin overdosing, whatever the condition is documented. And in last, you have to use a code for diabetes. Any questions so far? You guys are able to unmute yourself now. So just go. Okay, perfect. So what I'm going to do now, I'm going to pull the guidelines here. Just go through with the guideline. In the meantime, I'm going to send a question for the same situation. We will try to attempt that question once, and if we are able to solve that, then we will move further. So just go through with the guideline number A and the guideline number B. Just read it out. In the meantime, I'm going to send a question to you. I have shared one question over the group. Just try to solve that question in 2 minutes. It's 3:53 now. We will start discussing that question at 3:55. Okay, now let's try to attempt that question together. So I just received one response, and that is from Jamil. Also, that's not the correct response I'm looking for. So we have just studied. Okay, so Jamil, you are doing the question right now. Okay, so we just studied. Very good. So first we have to keep complication code. Then we have to use a code for overdosing or underdosing. We have to remember one thing, that we have to use complication at the primary position because patient have the issues in the insulin pump. Whenever patient have any issues in the implant, procedures, device, sutures, in that case, you have to use complication at the first position. So now what I'm going to do, I'm going to pull the complication in the index. Here we have the complication. Under the complication, we have to look for the insulin pump because it's a complication of our insulin pump. So on first gray line, we have to look for the insulin pump. Here we go. That is insulin pump. Under the insulin pump, we have to look for the mechanical breakdown. So our first code should be T85.614A. Okay, so first we have to use T85.614. Now we have to use a code for underdosing and overdosing. For underdosing and overdosing, we have to refer insulin in the table of drug and chemical. Where is the insulin? Here we have the insulin. In our question, it was mentioned that patient have the overdosing of insulin. So for overdosing, we have to refer the poisoning accidental. So our code should be T38.3x1A. And at the end, we have to quote the diabetes. So patient have the diabetes due to the diabetes with the comma. So for diabetes, we have to refer the diabetes in the index. It was mentioned that patient have a type 1 diabetes. So in the index, we will refer the type 1 followed by the hypoglycemia, or we can see the comma also. So comma due to the hypoglycemia. So our code should be E10.641. So for this question, we have to use these three codes. So whenever patient have a complications in the insulin pump, and due to that, if the patient have an underdosing or the overdosing of the insulin pump, in that case, you have to use three codes. Your first code will be complication, followed by the underdosing and overdosing, and at the end, you have to use a code for the diabetes. Any questions so far? Jamil, are you able to know that why we have to use the E10 code instead of the E13? Okay, good. So one more time, whenever patient have a complication due to the insulin pump, in that case, you have to use complication first, followed by the underdosing or the overdosing, then diabetes code at the third position. Now I think I have changed the setting. Now you can able to unmute yourself. So our chapter 4 is completed now. Now we have to start the chapter number 5. So chapter number 5 starts from series F01 to F99. Both from series F01 to F99 you have to use whenever patient have any mental, behavioral and any neurodevelopment disorder. So whenever patient have any psychiatric condition, in that case you have to use a code from series F00 to F99. So F00 to F99 you have to use whenever patient have the psychiatric condition. So let's start with the guideline first. First guideline we have here, pain disorder related to the psychological factors. So I'm going to pull two codes here. You have to tell me the difference between these two. Here we go. Here we have two codes, F4541 and F45.42. Just go through with the codes and let me know what is the difference you are able to identify with the description of these codes. Just go through with the description and let me know the difference between these two codes, F4541 and F4542. Any answers? Are you guys able to identify the difference between these two or not?
Yes, ma'am.
Okay, tell me what is the difference between these two?
I mean, F45.41, pain disorder with related to the psychological factors. So in that persistent pain disorder, but in 42 we have two types of pain like acute and chronic.
Very good. So in the F4541, patient have the pain that is related to the psychological condition. Like even in the real life, whenever patient have a increased stress, patient start getting the headache. So whenever, just because of the psychological conditions, patients start getting a pain. So in that case, we have to use F45.41 that will represent somatoform pain disorder. That means whenever we treat that psychological condition, pain will automatically resolve. In F4542, we have both the conditions. Patient who have the pain disorder, other pain disorder, as well as due to that pain disorder or even any other condition, patient who have the psychological factor. So whenever patient have the pain disorders and psychological factor which is unrelated with each other, so in that case we have to use F4542 and we have to use F45.41 whenever patient is getting pain due to the psychological factors. Any questions?
No, ma'am.
Okay, good. So F40, if we are using any code from series F45.41, you have to remember that you are not allowed to use any specific pain code in conjunction with the F45.41 because if we resolve the psychological condition, patient pain will resolve automatically and doctor does not need to do anything specifically related to that pain. So that's the only reason. In that case, we have to use F45.41 and we are not allowed to use specific pain code with that. But with F4542, you are allowed to use a code for pain as well as for the psychological condition. So, a pain disorder with related to psychological factor, we have two codes here. 45.41. With F4541, you are not allowed to use pain code separately.
Yeah.
And for F4542, you are allowed to use a pain code separately in conjunction with the F45.4. Next, we have another guideline, mental and behavioral disorder due to the psychoactive substance use. Psychoactive substance are alcohol, opioids, cannabis, tobacco. These are the psychoactive substance. So whenever patient is using a psychoactive substance and patient is getting any disorder, medical or any behavioral disorder due to the psychoactive substance use, in that case, you have to quote disorder, medical disorder at the first position, and then a code for psychoactive substance use and abuse and disorders if patient is using anything. We do have the code for the psychoactive substance use in remission. We have to use a code for in remission only if doctor mentioned that patient's psychoactive substance use is currently in remission. In that case only we have to use in remission code. If doctor does not mention it as an in remission, we should not quote the in remission. For in remission, we should have the documentation that state that patient's tobacco use disorder is currently in remission stage. So for tobacco use disorders or the alcohol disorders, we do have a code for the in remission stage. And we have to use in remission document states that patient tobacco use disorder or alcohol use disorder is currently in remission. Okay, just go through with the guideline number 1 and let me know if you have any question. Just read it out. So the conclusion of this guideline is just a one-liner that we have to use in remission code only if it is documented in the documentation. If doctor does not mention the in remission, in that case, you will not use the in remission code separately until unless provider does not specify in remission in the documentation. Next, we have the instruction for the psychoactive substance use, abuse, and dependence. So for same patient, if the patient is using that drug and doing the abuse also for that drug, in that case, you have to code only the abuse. Like we do have the hierarchy here, and we have to code the highest thing from the hierarchy for the same drug. So let's say for the same drug patient is using and doing the abuse. So in that case, you have to code the abuse only. And for the dependence, if the patient is doing the abuse as well as dependence, we have to code the dependence only. So we have to code the highest only from the hierarchy. So just go, I'm muting myself, just go through with the guideline number second once. Done with the reading?
Yes, ma'am.
Any questions, Amil? So the simple thing is, if for the same drug, provider is using that drug and abusing that drug, we have to code the abuse only. If the patient having a dependence as well as the abuse, we have to code the dependence only. If the use, abuse, and dependence, all three are mentioned, in that case, we have to code the dependence only. So we have to code the highest in the hierarchy. We will not code the two codes for the same drug. If the patient is using a different drug, let's say dependence of the alcohol and the abuse of the tobacco, in that case, we are allowed to use both codes. But if it is for same drug, we have to code the highest one only. Next, we have psychoactive substance use. Psychoactive substance use needs to be coded whenever patient have the any medical or behavioral disorder due to that psychoactive substance. In that case, we have to code the psychoactive substance use. If patient does not have any medical or any behavioral disorder, in that case, we will not use psychoactive substance use because that's not the disorder. If the patient is getting any disorders with due to that, only in that case you have to use a psychoactive substance use, else you will not use that code. So I'm just muting myself. Go through with the guideline number 3 and let me know if you have any. Are you guys done with the reading? Okay, I'm moving further. Medical condition due to psychoactive substance use, abuse, and dependence. It's the same thing that you have to keep your medical condition at the primary position. Then only you have to use a code for the use, abuse, or disorder if there is any. So you have to code that at the second position. Your first code will be a medical or the behavioral disorder, whatever the documentation says. Next code we have blood alcohol level. So we do have a one code for the blood alcohol level. And this code is from series Y90. It will represent whether the alcohol is present in the blood or not. It is not the qualitative, it's not the quantitative test, it's just a qualitative that whether it have the blood alcohol in the blood or not. So whenever there is an alcohol involvement in the blood, in that case, we have to code Y90. Now we have the next instruction here. Factitious disorder. So factitious disorder means patient have a disorder to create a incorrect facts in regards to the patient's health. Let's say patient does not want to go to the school and patient starts saying that I'm having a stomach ache. That means patient have the factitious disorder and patient is using the incorrect fact for himself. So if the patient is using the incorrect facts for himself, in that case, we have to quote F68.1 And if the patient starts giving the facts about someone else, in that case, you have to use F68.A. So you have to code F68.A whenever patient is creating a facts for someone else. In that case, you have to use F68.A to have the factitious disorder. I'm just muting myself. Just go through with the guideline number C and let me know if you have any doubts. Any questions so far? Are you guys done with the reading? Simple thing. We have two types of factitious disorder. Factitious disorder imposed on self and factitious disorder imposed on other. If the patient start making the facts incorrect facts for himself or herself, that means in that case we have to use factitious disorder on himself. And the patient starts making the incorrect facts for any other patient, in that case we have to use factitious disorder by the proxy. Next we have dementia. Our dementia codes varies based on the severity of the dementia, whether it's an mild, moderate, or severe. If the stage of the dementia is not mentioned, you have to use unspecified dementia. And if the stage of dementia is documented, you have to use a specific code based on the documentation. Now I'm going to send you one question for this chapter. We will do that question first, then we will move further. I have sent two questions, one for the cannabis and one for the opioid. Just try to do the question for the cannabis. Neglect the opioid, or for the opioid, we will do it later. Now just do it for the cannabis. I haven't received any response yet. Okay, very good. So now let's do this question together. So our question says the patient have the cannabis dependence and the cannabis abuse. So whenever for the same drug, we have a two types like abuse and dependence, we have to quote the highest one only. So here the highest one is dependence. So we have to quote the dependence only. So what we will do here, we will look for dependence in the index. So 9.1 670 page number.
172, ma'am.
Here we go. So dependence. Under the dependence, here we have the cannabis. It says under the dependence, you have to look for drug followed by the dependence. Sorry, followed by the cannabis. So here we have drug, cannabis, and our code should be F12.20. Here we will not quote cannabis abuse because whenever we have a dependence and the abuse of the same drug, we have to quote the dependence only. Any doubt? Zamil, any doubts? Are you able to do this question?
No, ma'am.
Ma'am, if there's any different, if the patient has acute toxicity due to the overdose of any such, yes. So if the patient have the toxicity due to the overdose, in that case, you have to follow the drug table and you have to quote the abuse. That's not the dependence case. So you have to quote the abuse. And if due to that toxicity patient is getting any symptoms, you have to quote the symptoms also. Now let's get back to the guidelines. Okay. Now let's start with the another chapter. Here we go. Chapter number 6. Diseases of the nervous system. So our F series is for the psychiatric condition. We have to use a code from series G whenever patient have an issue in the nervous system. We have to use a code from series G. Our first code is dominant and non-dominant side. Whenever in this chapter we do have a code for the monoplegia, hemiplegia, paralysis, and then in that monoplegia, hemiplegia, and paralysis codes are divided based on the dominant as well as the non-dominant side. Dominant side means the side patient used for his usual activities, that is the dominant side, and the opposite side will be the non-dominant. Let's say if the patient is right-handed, so if the patient is right-handed, then their right side is dominant because patient is using the right side for the most of their activity. And left hand is non-dominant. And if the patient is left-handed, patient is left-handed. So in that case, left hand is dominant and right side is non-dominant. So our monoplegia, hemiplegia, paralysis codes are based on the dominant and non-dominant side. If the documentation does not have the information of the dominancy, whether the right side is dominant or the left side is dominant, in that case, we have to use or we have to consider right side as a dominant and the left side is a non-dominant. Because for most of the patients, left side is dominant and the right side is no, right side is dominant and the left side is non-dominant. And for ambidextrous patient, ambidextrous means that patient is able to use both the sides. Ambidextrous means we have to use right side is a dominant as well as the left side is a dominant. So if the patient is ambidextrous, we have to use dominant code only. We will not use non-dominant code. And if the document does not support or specify the dominant sides, in that case, right side is dominant and the left side is non-dominant. Next, we have other guidelines. Next, we have pain category. We have to code pain only if the patient is coming for the pain management. If the patient is coming to get the treatment for a disease, in that case, we have to code the disease instead of the pain. Let me open this just a second. Here we go. So whenever patient is coming to get the treatment for the pain management, in that case, we have to code the pain separately and disease at the second number. But if the patient is coming to get a disease management, so we have to code only the disease. We will not going to code pain. We have to code pain only if the patient is getting the treatment for the pain. If the patient is getting a treatment for the disease, then we have to code the disease. We will not use a code pain from series G89 because that is inclusive in the disease code. These are pain codes. So first we have central pain syndrome. Central pain syndrome means that patient have the pain due to the central nervous system. Then we have G89.1, acute pain. This is an incomplete code. Below are the subcategory of the pain. Let me go here. Under the G89.1, we have three options here. Acute pain due to trauma. And we have to use acute pain due to trauma, G89.11 as in primary always. We have to code site as in secondary. Then we have acute post-thoracotomy pain. With the acute post-thoracotomy pain, we should not use the site-specific pain because site is inclusive. Hence, we will not use the site-specific pain here. Then we have G89.18. acute post-procedural pain. Whenever patient have the post-procedural pain, when we have the post-procedural pain, in that case, we have to use G89.1 and we have to specify the site separately. We have to specify the site. Site specific. So whenever patient having acute post-procedural pain, so in that case, we have to quote site separately and acute post-procedural pain as in primary. If the patient having a post-tracheotomy pain, then there is no need to quote for site. No need to quote for site. Next section we have chronic pain. For chronic pain also we have the separate sessions and we have a same type of codes except G89.29. Under the chronic pain, our first code is G8921. That is same as G8911. G8921 is chronic pain due to trauma. So you have to keep this code as a primary always, same as G89.11. And you have to keep site at the secondary position. Then we have chronic post-tracheotomy pain. In this case also, in chronic post-tracheotomy pain also, we don't need to quote site separately because in the post-tracheotomy, site is already mentioned. And then G8928, other chronic post-procedural pain. G8928, other chronic post-procedural pain means we have to quote this if the patient is having a post-procedural issues without complication. In that case, you will use this code as a primary. If the patient has post-procedural pain with the complication, in that case, you have to quote the complication at the first position. Then G8929, other chronic pain, we have to use this code whenever patient have the site-specific chronic pain. So if the patient have the site-specific chronic pain, in that case, we have to use G89.29. So last code we have G89. We have to use this neoplasm related pain. When we have a same code for acute and chronic, we have to use G89.3. When the patient have the pain related to the cancer, in that case we have to use G89.3 and G89.4 whenever patient have the chronic pain syndrome. Chronic pain syndrome means that patient have the multiple pain which is chronic in nature. chronic pain syndrome and the central pain syndrome. These two are the different things. Central pain syndrome means that patient has some issues due to the central pain, and chronic pain syndrome means the patient have the pain disorder which is chronic in nature. And one more thing, we does not have any time frame to quote the chronic. We have to quote the pain chronic whenever pain is listed as chronic in the nature in the documentation. Okay. Now let's go through with the guidelines which is mentioned here in the book. First, let's go through with these. So whenever patient have a chronic site-specific pain, we have to quote a specific pain as in primary, followed by the chronic pain, that is G8929. Whenever patient have a pain due to trauma, you have to use 1 or 2 based on the acute and chronic. And secondary is a site-specific pain. Then we have a post-procedural pain. Post-op pain means basically post-op pain is not separate. Routine post-op pain means it is included in the surgery, so we are not going to bill it separately. Whenever patient have post-op pain due to the complication, you have to quote the complication as in primary and then as in pain code. If the patient is coming with the pain which is not associated with the complication, in that case, you have to use a code from below series. Next, we have pain due to cancer. So if it is due to cancer and patient is coming with the pain, so you have to quote with the pain as in primary and cancer as in secondary if the patient is coming for the management of cancer. So in that case, we have to quote cancer as in primary, pain as in secondary diagnosis. And again, if the patient has pain due to trauma, you have to keep these code as a primary and second will be your site or location where the patient had the pain. So now let's go through with the guidelines through the book. So these are the same information. I'm going to send one question to you, all of you. Try to do that question first, then we will go through with the guidelines. Let's say patient have the chronic right shoulder pain. The question will be chronic right shoulder pain. Now just try to solve this question. Ramil, please refer to screen and see do we have to use any other code also. Your G8929 is perfect. Let's see if we have to use another code also. Okay, let's try this question together. So in our case, patient have the right shoulder pain that is chronic in nature. So we have to quote the shoulder pain at the primary position. We have to refer the pain. So what's the page number of the pain? 331. Let's try 330. Here we have the pain. Under the pain, we have to look for the shoulder. Shoulder. This is an incomplete pick code, so we have code should be, it is on right hand. So 511. Now we have to use a chronic. So chronic is 389.29. So we have to use these two codes here. This is our site specific code, which will tell the location of the pain. And this is the chronic pain, which will tell the chronicity of the pain. So here we have to use two codes. Clear? Any questions, guys? Anything you want to address? Okay. So now what you guys have to do, you have to read all the guidelines listed in the B section in the chapter number 8. I think it's the chapter number 7, sorry, 6. In the chapter number 6, you have to go through with all the guidelines. These guidelines are the same, which we have just gone through with in the form of presentation. So just go through with the guidelines after the class and let me know if you have any questions or doubt. I'm going to send few assignments to you. And from next chapter, we will start the chapter number 7. One more time, does anyone have any questions from the previous sessions or from the today's class? Okay, now let's wrap up. Thanks everyone. Bye-bye.